Hi, everybody. It's Ariana Anderson here. I'm a traditional naturopath working at Anderson Family Chiropractic and Naturopathic Care in Waterville, Ohio. We're going to talk a little bit more about food intolerance and food allergies and what's the difference. A lot of times there's a lot of confusion of the two. So we're going to do just a really brief history of definition of allergies, and then we're going to talk a little bit about the differences between the two. So give me a second here and let me pull that up. So, so this quote, many of you probably know. Hippocrates is the father of modern day medicine. And this is a quote by him: "Let food be your medicine, and medicine be thy food." You know, and it's interesting that that is so true today as it was then. But we don't seem to get a lot of training and understanding about how food and herbs and plants can be helpful to us and our bodies. So definitely that's one of the core values of our practice. And we'll get into it a little bit today, but that's a core philosophy of how we do our practice here, is that we we go back to nature and use whole food things to help support your body's ability to heal. So let's talk a little bit about, make my picture a little bit, I'm a little bit smaller here. A little history on allergies and when they started to be written about in medical literature and then started to be defined. So in 1906, Baron Clemens von Perquet, he was a pediatrician, and he found young patients with reaction symptoms when certain foods were eaten or exposed to pollen or an insect bite. And he called those altered reactivity, or what we now know as an allergy. In 1925, allergy was then officially defined as a reaction where the immune system was demonstrably involved, mainly through skin prick tests. This did not include any delayed or masked food allergies in that definition. So those are different. They are more of a slower response, and they have fewer symptoms sometimes than something that would be more of the traditional allergy as it was defined. But they are both two different things that can occur and cause a lot of problems for people. So it's important for us to see that these two things do exist and try to define them as such. In the 1960s, they were actually able to sort of catalog the villain of the traditional allergy, right? The more anaphylactic reaction that we're used to. I know that's from an immunoglobulin E, or IgE. And so they were able to, they had created a RAST test that could confirm IgE antibodies, and that would confirm what they would consider a diagnosis of that particular problem. Now, there really wasn't much attention to those mast or food allergies, mainly for the two reasons at the bottom of this slide here. Two reasons would be that the medical establishment at the time, they were reluctant to try to define it because there really weren't clear standards of care in these cases, mainly because it was difficult to diagnose them. There wasn't like there wasn't a standard test they could use. Sometimes these symptoms were varied, and they could be delayed. So it was very difficult to be able to put a standard of care around that. And then also large food manufacturers and their lobby, they didn't like the idea that whole food sections of the populace could, if they discovered that eating wheat or milk, which were the common food allergens, they might actually try to avoid them. And then of course that would decrease their profit. And unfortunately, that's just the way it is. Businesses will try to, hide some of this information over time because it impacts their their bottom line. And I think that we've seen that repeated in history, and that certainly did happen here as well. So here's just a couple stories, and I think that you may relate to one or even both of these stories, because you can actually have both things going on. You can have those immunoglobulin E reactions to certain foods, and you can also have those masked or delayed reactions. They're just different functions in the body. So you could relate to either of these stories. So Jane's story, as an infant, she had colic, she vomited, spit up very often, she had eczema. As a toddler, she had mild hay fever and asthma. Her mouth and tongue swelled after eating, sometimes having to be rushed to the hospital. And using a skin prick test, she was found to be allergic to cats, peanuts, and grass. Right? So that's a classic allergy story. But then there's Susan's story. As a toddler through adulthood, she had frequent colds and chest infections. As an adult, she had diarrhea while traveling, never fully healed, eventually diagnosed with IBS, or irritable bowel syndrome. She had a lot of headaches, sensitivity to light, sensitivity to chocolate, alcohol. She sometimes would get knee pains. She had found that she had intolerances to milk, wheat, rye, barley, yeast, oranges, lemons, beef, and tomatoes. And so you can see that these two individuals, and these actually were real life people, had allergic reactions to these things, but very different symptoms, right? So you can see how it might be difficult for anyone in the medical profession to have diagnosed these things back then. And so, understandably so, right? Because they aren't the same and very different. And really, ultimately, what they found is they have different immunoglobulins being created in these two different scenarios. And so antibodies are, we call immunoglobulins. And so this is, you can't really see over here, but IgG, IgA, and IgE. And so IgE, which I had talked about, immunoglobulin E, food reaction, is what we would call the classic food allergy. There's typically immediate symptoms, and sometimes they can be very life-threatening. Common diseases and symptoms are hives, difficulty breathing, vomiting, hay fever, asthma, non-seasonal runny nose, eczema, and anaphylactic shock. IgA, so immunoglobulin A food reactions, they are more severe intolerance reactions. So people that have those are typically, one example is people that have celiac disease. The symptoms are typically more severe, delayed though, and they were primarily in the intestinal tract. A lot of times there is irritation and inflammation of the intestinal tract every time that particular food is consumed and runs through the intestines. Common symptoms are diarrhea, loose stool, constipation, gas, acid reflux. They oftentimes have vitamin and mineral malabsorption because of the inflammation in their intestines. They sometimes will have what's called intestinal hyperpermeability, or sometimes that's called leaky gut, which we'll talk about in a minute. So oftentimes they will have severe abdominal pain, nausea, skin rashes, respiratory issues, and also irritability. And it's interesting that respiratory issues, there definitely is a connection between the gut and the lungs. That's actually something that folks in the eastern side of the globe, they've known for quite a while. And so that's just something that often does happen with people who have gut issues. Now on the bottom here, immunoglobulin G food reactions, that oftentimes seems to correlate to autoimmune disease damage. Oftentimes they are very delayed symptoms. They can be hours to days. When food particles find their way through the hyperpermeable gut lining, it shouldn't be there. The body creates these antibodies to clean up the foreign food particles, because those should never get into the blood. Common diseases and symptoms are inflammation, constipation, Crohn's, diarrhea, eczema, flatulence, irritable bowel syndrome, migraines, obesity, and psoriasis. So you can see that there's a little bit of some symptoms in all of these cases. And so it does make it a little bit complicated to try and figure out what's going on. And keep in mind, some people might be having multiple reactions going on, right? And so, but definitely in these two categories here, the immunoglobulin A and G, there's typically foods involved. And so it becomes really important that if those things are actually causing that inflammation, that we bring those out of the diet so the body can heal and recover. So food allergy, food intolerance, and food sensitivity. Most of the time with allergies, those classic allergies, immunoglobulin E reactions, they are diagnosed with a skin prick immune reaction test that will confirm that. Um, and then for intolerance, interestingly enough, skin prick tests are really not very helpful in that. And so, um, really, those oftentimes can be used with, there's blood tests that can be done, but unfortunately they're not always really reliable. A lot of times what ends up having to be done is food elimination. So elimination diets for a period of time, and then you reintroduce those things and see if you have reactions, which is, inconvenient and a little bit difficult, but really that's the best way of going about doing it. So food allergy, you're going to think that there's that big, more aggressive immune reaction that's immediate. And then food intolerance, there's going to be that difficulty digesting, and you tend to have more of those delayed or masked reactions over time. Now, when you hear the word food sensitivity, that term is actually used for both. That could be that they're talking about food allergy, or they could be talking about food intolerance. And so it's best if someone is using the word food sensitivity to ask them for further definition of what they're actually talking about. This is interesting. Okay, so a discussion on exofins and endorphins. You've probably heard of endorphins, but probably not exorphins. And so endorphins are natural opioids. They're the ones that make us feel good, right? Painkillers of the body, if you will. They can bind at certain receptor sites in the brain. Interestingly enough, morphine, heroin, and other opiates are chemically similar to endorphins, and bind at these receptors and suppress the body's natural ability to produce endorphins. So that's interesting to note. But exorphins, which is interesting, those are actually, that name was coined by Dr. Christine, and I think it's pronounced Zudrow, and her colleagues. And what they found was that wheat that combined with digestive juices can create polypeptides, which are called exorphins, that can pass the blood-brain barrier and bind at the same receptor sites as endorphins. So think about when you eat bread. Does it make you feel good and happy? A lot of times when we talk about bread and pasta and donuts, well, of course, that's got some sugar in there too, right? We think about those things as comfort foods, right? We'll even call them that because they sort of make us feel good. And so clinically, they've actually found that those particular proteins mixed with digestive juices can create these polypeptides that can mimic endorphins in the body. And so another reason why sometimes we are sort of addicted, we feel a little addicted to these things, right? Because we're kind of, as down here, we're exorphin junkies, right? And the people are eating bread as a bit of a drug-like response that they're getting. They actually recreated that test with milk, corn, and barley. So all of those things have the ability to create those exorphin particles. And so anyway, they also had done an naltrexone, which is an opiate blocker study that showed that it actually would block those polypeptides the same way it would opiates to confirm that they actually do exist and do bind at those receptor sites. So but it seems to be more prevalent that these things occur with individuals who have what's called leaky gut, or as I mentioned before, that's hyperpermeability of the intestinal wall lining. These peptides can get directly into the blood before they're broken down by other enzymes in the digestion process when someone has that hyperpermeability. And so oftentimes they will have more of a reaction, this exorphin reaction with things like wheat and dairy, which makes them feel good, and they tend to kind of go back to that. But unfortunately, that can sometimes make this some of the reactions worse because they have a sensitivity to those things. So what causes food allergies and sensitivities? That's always the next question. And honestly, if people are being honest in anywhere in the health and medical world, what they will say is that we don't actually know, not for sure. There's a lot of theories though. So gut dysbiosis, what that means is that there's an imbalance of the gut flora. That could be a possible upstream problem and leading to this. Leaky gut, as I mentioned, that hyperpermeability of the intestinal wall that can lead to infection and inflammation. Lowered enzyme levels, lowered hydrochloric acid in the stomach, which would lead to improper protein molecule breakdown. Toxic chemical exposure. There are case studies that have confirmed that this can cause food intolerance. Groups of people have been studied where they had toxic chemical exposure, and then all of them, or a large percentage of them, exhibited food sensitivities and allergies following that chemical exposure. Bottle fed versus breastfed, and then babies, and then severe nutrient deficiencies. And we're going to talk about each one individually here. All right, so gut dysbiosis, or where the microflora in your gut is out of balance. You should have anywhere from 500 to 1,000 species of bacteria in the gut, and honestly, that keeps growing the more that we learn more about what's normal in the gut. But at least that they actually don't do us harm. They actually are super helpful. These are some of the things that our little buddies, I like to call them, our little bacteria that are in our gut. They help with vitamin production. They can create enzymes for digestion. They actually have been found to have communication with our own immune system, which is pretty fascinating. Seriously, that's a very interesting research. If you go in and look up some studies on that, they actually have seen that they can interact with our immune system. They can prevent harmful microbes from taking up residence. So it's really important that we have good microflora. And it's not just about taking a probiotic, by the way. It's about making sure that your food that you're bringing in is feeding them properly. Some of these bacteria actually require fiber as their primary food. And guess where you get fiber from? Vegetables. You know, we should be having anywhere from like 5 to 7 sources of vegetables a day. I don't even hit that. So I'm just saying that we don't get in our diet what we need to keep a good, healthy flora going, right? You got to feed them. You got to feed the little buddies. And then consider the role that antibiotics have played in gut dysbiosis, right? When you bring in a broad spectrum antibiotic, it kills many of those species, those bacteria. And they've shown in studies that consecutive antibiotic treatments actually decrease that more and more and more exponentially. So, and most people have had way more than just one antibiotic treatment in their lifetime. And also keep in mind, Candida albicans is a type of yeast fungus, and it is naturally occurring in the gut, but it is a very hardy organism, and it is not going to be killed by an antibiotic. So if you're taking an antibiotic, especially regularly, what can actually happen is Candida albicans becomes way too proliferant because it doesn't have any competition, right? So those bacteria got killed, and so it's like, oh, I'll just, take over this block, and then it can be very proliferant and start to actually morph into, instead of like an aerobic Candida albicans, they start to become anaerobic, and that actually becomes a more they cause a lot more problems. They can actually kind of burrow into our intestinal walls, causing infection and then more severe increase in gut permeability. So it's important that we make sure that we're feeding our bodies properly, so that the good bacteria in our gut are fed and healthy. So, all right, leaky gut. So that's that hyper permeability of the intestinal wall. It can lead to infection, like I was mentioning with viral, fungal, and inflammation. And so this is, I think, a good illustration of your intestinal wall has, these intestinal mucosal cells, right? And so they're all connected with these little junctions here. There's an enzyme reaction that sort of keeps those tight. And so there should be a little bit of a space for certain nutrients to kind of come through and get into the bloodstream, right? That's how we get building blocks into our bloodstream for building new tissue, right? From our food. But what happens is, unfortunately, sometimes there can be this, like, these junctures are a little too wide. And so then we start to get particles that should never be able to get into the bloodstream, including um, uh, microbes, including food particles and things like that, that should never get into the blood. And if they do get into the blood, what will happen is your body will recognize that as foreign and start to create antibodies to go and clean it up. And that's what it's supposed to do. But the problem is that it keeps happening, and we keep getting more and more of that coming into the bloodstream unless we support the healing and restoration of that gut lining. And there is a lot that can be done for that. So I do think this is one of the upstream problems of allergies. And so it's one of the things that absolutely is a foundational pillar in our nutritional health programs to help support people's ability to heal and restore function in this area. I would be remiss if I didn't talk about gluten because this is just a quote by Isabella Wentz. She's a doctor of pharmacology. And she had said that gluten has been the most well-researched protein-associated immune reaction, and it seems to cause an increase in intestinal permeability in everyone, not just those who have genetic susceptibility to gluten sensitivity. And I have seen in other books and research where they have talked about that the reaction that can occur with certain proteins within the gluten molecule that can interfere with the enzyme reaction that keeps these junctures tight. And that's the issue. And so I think it's something like 12 seconds when it comes in contact with this reaction. But the problem is that if you're constantly eating wheat, it's just constantly coming through your gut wall, right? So when gluten is coming through here, and if you're getting a lot of it, it's hard to break down. It's just this constant bombardment on these intestinal mucosal cells, causing this situation where we start to see hyper permeability. So definitely a big deal. So lowered enzymes and hydrochloric acid in the stomach can also be an upstream problem for this. Digestive enzymes help to break down our food into smaller molecules. They're made in the body. The parotid glands do assist with that, the gut and the pancreas and the liver. And so we also make detoxification enzymes in the parotid glands, the gut flora, and the liver. And if production capacity is limited, the body is unable to detoxify damaged tissues too. And so that can be a part of the problem. Hydrochloric acid in the stomach activates what's called pepsin, which is an enzyme that breaks down protein, which can cause us to have inadequate protein digestion. And so we'd have larger molecules that are harder to break down in the intestinal system. And then that can actually lead to meat proteins and things like that have not been broken down properly, that can lead to lower bowel toxicity, which can cause infections and things like that. Toxic chemical exposure, as I had mentioned, there have absolutely been cases confirmed that have led after the toxic chemical exposure of, like, say, a whole group of workers, that then within a certain period of time, like 80% of them would develop these food intolerances. And so we do think that there are certain chemicals that can cause some of these problems in, our alimentary canal, which is, anywhere from the mouth to the rectum, through that intestinal process, that it can cause damage to those tissues. And also people with enzyme deficiency are more vulnerable to toxic chemicals and heavy metals as well. So bottle feeding and breastfeeding, and this is really important to just kind of take a step back and say, here's the thing. The most important thing is that we have healthy babies, okay? And so, we can support the people's microbiota and their gut health, even if you're bottle fed, okay? And so there's no judgment in this whatsoever. Our goal is to have healthy babies, regardless of whether you can breastfeed or not. this is just some studies that have shown that breastfeeding is better. It really does help babies to develop a more robust microbiome in the gut. So studies have shown exclusively breastfed babies for at least 6 months are less likely to develop food allergies, and the baby's gut linings are hyperpermeable by design. So they're made that way because they're supposed to be getting milk in, right? And so in those first few months, to allow protective antibodies from the mother to the baby, and it's supposed to be milk, not solid food, right? And so it is hyperpermeable in that period of time. And so it is going to be more susceptible to dealing with foreign proteins and things like that that can't be broken down. Um, and then breast milk proteins are just easier to break down due to enzyme content. So it's just, it's a symbiotic process between mother and baby. So if you can breastfeed, then you should. Absolutely, I'd encourage you to do it. If you can't, then there's no judgment in that. And there's things that we can do to help support the baby's gastrointestinal system while it grows and it develops in those first, 1 to 2 years. So this is interesting. Dr. Lepore, he had actually found that there are specific vitamins, minerals, and amino acids that are necessary for complete absorption of particular foods. And so when these nutrients are severely deficient, it creates what is called a metabolic antagonist or an intolerance to the food. And once the depleted nutrients are replete, the offending food is reintroduced to the diet. And this I have found to be the case. It's a little bit more difficult because you have, a lot of times people have more than one food intolerance, but I have seen that this is true. This is just two of them, and he had a whole list of different ones and different vitamins, minerals, and amino acids that are needed for proper digestion of these different foods. But this is milk and wheat. In milk, you have to have adequate vitamin D, potassium, and both aspartic and asparagine amino acids. And I have found people with milk problems that when those three things are added to the diet, they tend to have less problems with that particular food intolerance. And then the same thing with wheat. So wheat is fatty acids, particularly linoleic, magnesium, and histidine. And when those are brought back into the diet, that the person has less issue with the digestion of wheat. Now, there are obviously exceptions to that. Some cases are more severe than others, but I have seen that that there is some validity to this, which is, pretty interesting. So, this is the thing. Like, why does this matter, right? So, other than the symptoms that you're experiencing, but like when you have food disorders, what will happen is the more often and severe the symptoms, the more stress on the organs, using up more vitamins and minerals, which is going to lead to nutritional deficiency. And even if it's just like a 1% decrease, right, of function, but the problem is that now we have less vitamins and minerals to fuel our organs, which is going to lead to just a little bit of organ dysfunction. Even so, like say, like it's just 1%, but now the organs are not working 100%; they're working 99%. And so this is going to decrease the ability to absorb, digest, and utilize vitamins and minerals. And then, of course, if we still continue to have these food problems, then it's going to keep happening. And see, eventually over the years, we get to like 80% and then down to 70 and 60 and whatnot. And then usually when I start to see people is when they've lost a considerable amount of function and they're in their, usually 30s to 50s. And so these problems have been baking in there for several decades. And so we have to do a lot of course correcting to get them back into optimal health. And so what's best is if the earlier we can start kind of intervening with this and doing some course correction on how you eat, how you move, and how you think. If we can get those things in balance, the earlier we can do that, the better. And what I found is that most people just don't get a lot of education on how to properly support themselves and their bodies. And so that's one of the things that we do here in our programs. So, think about it. What's the effect of organ dysfunction on your lifestyle? Impatience with children, spouse, job, low performance in your job, hobbies, lack of energy to living life to the fullest. I mean, really, it comes down to how serious we are to handle it, because there are a lot of things in our lifestyle, our American lifestyle, that are kind of backwards to health. And so, it does take some time and energy to to change those things. And it doesn't happen overnight. And so one of the things that we do here is we help coach people through that, and act as an accountability partner with them to help them to reach those goals. But so how can we help? So how do I help specifically? On my side of our shop, I help people to find out what specific vitamins and mineral deficiencies they may have, and then find exactly what organs are being affected, and then fix and handle them once and for all. My main modality is nutritional response testing. It helps us to assess how well your body is functioning. It helps us to assess what nutritional deficiencies that you might have. And we're going to actually record a video with a short description of how nutritional response testing, or NRT, works. And we're going to do that this week. So make sure to subscribe to our channel and hit the bell to get an update when we post that video. So what we do is we put together design clinical nutrition programs for people. So one of the things that I found that is the most difficult for people is they really care about their wellness. There's so many more people that are out researching, trying to figure out how to be well. But there's so much information that it feels really overwhelming, and they're not sure, like they've got a box full of supplements. They don't know what to take. They don't know how to support their body. So because it just becomes really daunting. And so that's something that we can help with. We will create programs that are specific to your symptoms and problems. We address the reasons why you are having health issues as opposed to why your sister or neighbor, because we're all different, right? We're all a holistic unit. And it's really important to look at the whole body and see what's happening from a holistic perspective. We do not use a magic recipe attempting to use a one-size-fit-all approach for everyone. You know, if everyone had tailor-made suits, they might look similar, but they're all going to be slightly different. They're going to have different inseams, different waist size. We're all different, and we all have a different tangle, if you will, on the inside. And that takes time and effort to unravel and help people get to be their best self. So the first step really is to determine if you are a nutrition response case. And you can feel free to call our office to schedule a free consult and a screening. That's about a 20-minute appointment. Our phone number is 419-878-8312. And then our website is www.afc. Oh, this is spelled wrong. Sorry. It's AFC. There's no E there. It's just AFCwellness, all one word, .com. I apologize for that. But you can feel free to give us a call at any time and schedule that consult. You know, what I found, people that fit well in our programs, or at least our programs fit well with them, is that there's two things. One, that you believe that your body can heal, that you believe innately that your body has the ability to heal and restore function, and that you want to be well. If you are those two things, those are the two things that I have found, the people that have done the best on programs, those two things resonate with them. We can help you get there, but ultimately it's a lot of work to be well, and it's a lot of investment of your time and energy. But I've seen some really amazing things that people can do when they decide that they want to be well and they believe their body can get them there. So just a real quick thing about us. This is really important. Anytime you're looking for a practitioner, you really should look at what their health philosophy is and their goals, because every health practitioner has different modalities or tools that they use. And these are ours. So one, our goal is ultimately to help support your body's ability to increase overall health and restore function. We are not a quick fix shop. That's not how we roll. And we're real upfront about that. We're in it for the long haul to help your body restore function naturally. You must have an open mind to try something new. Nutrition response testing is a little bit different. And like I said, we'll be putting that video out, and you can kind of look at that and see if it's something you're interested in. And it also will probably require several months to really make improvements in your case. Natural health just takes time. You know, we're not using drugs that are going to force your body to do certain things. We're going to support its ability to heal and restore function, and that takes time, because it took time to get there, right? And then we have a commitment to using safe and natural things. The majority of what we use are whole food supplements. Primarily, we use standard process and MediHerb. And so those are vitamins that are different. They're not the same thing as what you get like at Walmart, those Centrums and stuff. It's not the same thing. These are basically concentrated food pellets, and it's going to help to support your body with the foods that you're not eating. And so those things are specific and targeted to the nutrient needs that you need. And, because we use things that are safe and natural, it enables us to safely help all people, including those with medical conditions, those that are taking medications, elderly, and infants. So anyway, if you have any questions, feel free and give us a call. We'd love to sit down and have a chat with you. And just thank you for stopping out. We love when people decide to take time to invest in their health and learn a little bit more about natural health. So thanks. Have a great day.